In a world where breathing is taken for granted, imagine a condition that transforms each breath into a relentless struggle. Welcome to the hidden world of empty nose syndrome, ENS, where the simple act of inhaling becomes an excruciating ordeal. Can you understand the feeling of constant nasal congestion, even when your airways are open? Can you imagine a life plagued by unrelenting air hunger? Can you fathom the torment of severe insomnia, where you awaken multiple times every night, gasping for breath? And what if every inhalation inflicted a searing pain in your nose, offering no respite? These haunting realities are the daily battles faced by those affected by ENS. But the torment does not end there. Envision a nose so dry that it degenerates, bleeds, and falls victim to recurring infections, an endless cycle of pain and misery. The consequences extend far beyond physical suffering. Careers crumble, cherished lives dissolve into fading memories. The victims of ENS find themselves trapped in a world where every breath is a relentless struggle, a reality they never anticipated. Yet there is a darker side to this story. Imagine the condition being caused by a surgeon, whose very role was to provide aid. Now, also imagine that the full extent of the operation's consequences was withheld from you, leaving you completely unaware of the devastating aftermath awaiting you. This is the grim reality faced by many who have undergone surgery to the turbinates or septum. These patients were betrayed, forever altered by the consequences of operations they were never fully informed about. In this gripping documentary, we embark on a profound exploration of the troubling world of medical negligence and malpractice. Through intimate personal accounts, insightful interviews, and compelling research, we strive to uncover the disturbing truth behind ENT surgeons who knowingly harm their patients for the sake of financial gain. Join us on a journey of discovery as we shed light on the lives impacted by this widespread malpractice. Be prepared to be deeply moved and stunned as we unveil the heart-wrenching reality where countless lives have been shattered by deceit and harmful interventions. Procedures executed with methods that from the outset guaranteed a lifetime of suffering. This is a story that demands to be heard, a voice for all those who have already lost their lives due to ENS, and for those who battle each breath daily. Their suffering must not be silenced or forgotten. It's time to expose to the world the unethical and damaging practices that still prevail among ENT clinics in the modern world. Now, let's begin the presentation. Are you considering undergoing septoplasty or turbinate reduction? If so, this information is crucial for you. It's important to understand that these operations, even if deemed successful, can have adverse effects on the autonomic nervous system throughout the body. For many individuals, these operations can have a devastating impact, causing lifelong breathing problems that often present as paradoxical obstruction. This condition involves constant air hunger and a feeling of nasal congestion, despite the actual openness of the airway. The root cause is nerve loss and nerve damage resulting from the surgery leading to the activation of the sympathetic branch of the autonomic nervous system, causing distress and severe insomnia. Moreover, it is important to note that these operations frequently lead to long-term issues with the nasal lining of the nose. Surgery on the nasal turbinates often results in a dry and open nose, and this drying can over time result in the degeneration of the nasal mucosa. Secondly, it is also common that the dryness leads to recurrent infections of the nose, infections that often further deteriorate the condition of the nasal lining. Over time, the nose often becomes so dry that affected individuals experience great discomfort in the airway, even in normal environments, leaving many forced to constantly use ointments in the nose while staying close to humidifiers most of the day. Unfortunately, surgeons often hide these injuries and consequences prior to the operation. The risks mentioned typically focus on bleeding and infection associated with the procedure itself. The irreversible consequences that are highly likely to occur are often completely omitted. Before we continue, I would like to provide some background for this video. The background is that I have personally experienced an iatrogenic injury to the nose as a consequence of a routine operation involving the turbinates and septum. Upon realizing the reason for my problems, I dedicated countless hours to conducting extensive research. So the purpose of this video is to share the findings I have gathered in order to safeguard others from finding themselves in a similar situation. The condition I have suffered from is commonly referred to as empty nose syndrome in the medical literature. However, personally, I find it more appropriate to label it as iatrogenic nasal dysfunction. The term empty nose syndrome can be misleading as it implies that the nose must be completely devoid of turbinates for someone to develop this condition. This is not accurate, as individuals who have undergone nasal surgery involving the turbinates and/or septum can still experience the symptoms even if a significant portion of the turbinates remains. A more suitable name would be iatrogenic nasal dysfunction, because the term iatrogenic indicates that the damage is caused by a medical intervention, in this case in the context of a rhinoplasty. However, for the sake of simplicity, we will continue referring to the condition as empty nose syndrome in this video. Subsequently, we will use the abbreviation ENS for convenience. ENS is an extremely severe condition that has widespread effects on both the nasal region and the entire body, encompassing physical and psychological aspects. The likelihood of developing the condition increases when surgeons are overly aggressive during surgery, involving cauterization or amputation of tissue with sensory neurons, nerves responsible for detecting airflow along the nasal lining. Consequently, the condition mainly revolves around nerve-related factors. However, it is important to acknowledge that there are additional contributing causes to ENS that we will explore further in this video. Within the framework of ENS, several distinct issues are encompassed, with one of the most characteristic ones being paradoxical obstruction. This condition arises as a result of nerve damage and nerve loss, largely due to damage to the external nerve endings in the nasal lining. The condition causes a persistent sensation of nasal blockage, despite objective evidence indicating that the nasal airway after surgery indeed is open. Individuals afflicted with this condition can no longer perceive the cool airflow sensation within their nose. Consequently, the brain no longer receives the necessary signals indicating nasal respiration, leading to a feeling of air deprivation and breathlessness. This experience can be extremely draining and challenging for affected individuals, as the condition often persists over time. Additional symptoms commonly associated with ENS include a sensation of reduced or abnormal air resistance, leading to shallow and rapid breathing. This not only presents mental challenges, but also has a negative impact on oxygenation of the body. For more in-depth information on these aspects, I encourage you to explore my previous YouTube videos, which I have linked below in the description. The condition of ENS encompasses several additional issues, including problems related to the residual mucous membrane. These can appear as dryness, recurrent nasal infections, and discomfort caused by dry air. Most affected individuals need to maintain humidity levels above 40% to minimize pain and dryness. Individuals affected by ENS may also experience increased sensitivity and pain in the nose when exposed to strong-smelling substances or when exposed to chemicals or smoke. Furthermore, many individuals find themselves constantly relying on humidifiers to alleviate the discomfort of a severely dry nose. Additionally, individuals suffering from ENS may experience a painful nasal cycle, and in some cases, the nasal cycle may be completely absent due to a significant loss of turbinate volume. This leaves the nose wide open, resulting in a dry and painful mucous membrane that can degenerate further due to its dryness. Furthermore, as the condition often leads to significant sleep disturbances, daily distress, and light hypoxia, it can also contribute to accelerated aging and to the development of other illnesses. For a comprehensive understanding of all known complaints related to ENS, I invite you to explore the link provided below under the video description. See the link titled Empty Nose Syndrome, a guide to diagnosis and management for medical professionals. Now I need to tell you what I have learned during years of conducting extensive research. The individuals affected by this condition undergo unimaginable suffering, rendering many unable to work. and their once cherished relationships with friends and partners often crumbling under the weight of their struggle. During my dedicated 5-year research journey, I have come across first-hand accounts of approximately 10 individuals who reached the point of utter desperation, making the heartbreaking decision to end their suffering. One poignant story remains etched in my memory: the heart-wrenching experience of a Brazilian man battling ENS. His pain was so immense that he resorted to acquiring a firearm. In a poignant message to our Facebook group, he confessed his desire to end his torment, but at that moment, he couldn't summon the strength to pull the trigger. Tragically, a few days later, he had gathered enough strength to commit to it. Later on in the group conversations, we found out that he had shot himself in the head to flee from his ENS suffering. This cannot be ignored. We cannot allow surgeons to cause such harm to fellow human beings. Our healthcare system should be a compassionate place of healing, where treatments lead to enhanced health and well-being. It must not leave patients so broken and ill that they suffer to the extent of contemplating taking their own lives. This raises a crucial question. Does our modern healthcare system genuinely benefit more people than it harms? Based on my own findings from over 10 years of experience within the modern healthcare system, it is evident that we are in dire need of a transformative approach that considers the body as a whole. We must focus on holistic treatment, rather than merely addressing isolated symptoms with medicine and surgery as the first choice. A holistic treatment approach for nasal congestion is the way to proceed, especially when surgery on the turbinates causes irreversible damage, not only to the nose itself, but also to the autonomic nervous system throughout the body. These brutal and harmful operations must come to an end and be relegated to history, similar to the madness of lobotomy. These organs must be considered as important as any other organ in the human body, and they should not be removed unless they are affected by cancer and cannot heal naturally. At the very least, it should be mandatory for surgeons to communicate any potential consequences of septoplasty and turbinate reduction. This is particularly crucial when surgery to the turbinates is designed to destroy the organ itself. Now, let's delve into the heartbreaking interview with the daughter of Dory Lodge. Dory, a beloved wife and mother, underwent a routine cauterization of the turbinates. Little did she know that this procedure would lead her down a path of excruciating suffering. In the months that followed, her pain became insurmountable, and tragically, she found herself making the unfathomable decision to end her life. The weight of her loss still lingers online as a poignant reminder of the devastating consequences that can result from these surgeries. Now let's start the interview.
My mother got a simple routine surgery December 28th, 2018. She went to an ENT to get her nose cauterized. The doctor told her there would be no side effects, in and out. Within 3 days, immediately, she felt the effects of the cauterization. She couldn't sleep, she had suffocation, dryness. She once explained to me that her nose felt like it had a million little cuts in it. She went back to the ENT. He assured her everything was fine. There was no reason for her to not be sleeping or to have this pain in her nose. So he referred her to see a primary doctor. She went from doctor to doctor trying to find out what was going on. This was immediately after she got the cauterization that she just never slept again. She would maybe sleep 10 minutes a night, half hour a good night. She would see her primary doctor, who would refer her to a therapist, who would then refer her to a sleep specialist. They would prescribe anti-anxiety medicine, advise that she had depression or anxiety. That was her cause. They said everything physically was fine with her, and she had no reason to not be functioning or to be not sleeping. She had She was very upset that she felt like they weren't taking her seriously. She felt that the doctors were prescribing her a prescription and wanted to be done with her. She had no faith in actually the medical system because of this. She knew she wasn't feeling this right. I mean, she was 57 years old. She knew something was not right with her body when every doctor told her it had to be depression or anxiety, when she couldn't sleep or breathe. She couldn't breathe properly. She had constant suffocation. My mom was the most loving, caring, best mother in the world. She did everything for my family, my husband and I, my brother, my dad. She did a lot for us, and she went from being this happy, caring person that cooked dinner for us every night and did anything that we asked of her, to not even being able to enjoy our company because she was so embarrassed and felt so upset in how she was embarrassed. She didn't want people to see her the way she was. She was amazing, and it happened so quickly that she was herself, and then 3 months later, within that short amount of time, she changed so drastically.
So you say that was the first time she slept for 6 solid hours in 2 months?
Yeah. Yeah, since she had her nose cauterized December 28th, she never slept a full night's sleep.
What were her main symptoms?
Shortness of breath, suffocation, trouble breathing, trouble sleeping, lack of appetite. She just became very different, not the mom that I grew up with.
So she was planning to see this doctor for a procedure prior to her passing. She never made it there. Was there something that happened that made her lose hope?
Yes, we found her phone the day she died, and we found that there was a call made to the doctor in LA, and the nurse, I believe, told her that the surgery may help, but it's not going to solve every issue, and she may never be 100% again. And then to get that call from the surgery coordinator or the nurse to say, this may solve your problem, but it also may not. So the possibility of it not helping her, she lost complete hope, and that's when she decided to end her life.
As you have witnessed the consequences of these surgeries, the heart-wrenching reality becomes clear. Now, the question that remains is, are the surgeons themselves fully aware of the immense suffering they inflict? Do they truly grasp that they are causing harm to an organ vital to the well-being of the patient? Or have they become so brainwashed by the healthcare industry that they naively believe there are no consequences to destroying the nasal mucosa? This is something that has haunted my thoughts, and the conclusion I have reached is deeply troubling. To enter medical education, one must achieve stellar grades. It is reasonable to assume that those admitted to medical school possess a relatively high, or at least a normal IQ. They don't need to be geniuses like Einstein, but a certain level of intelligence is required. Thus, the issue does not lie in a lack of understanding or IQ among these surgeons. They are fully aware of what the turbinates are, their significance, and the potential repercussions of destroying them. However, one cannot ignore the harsh truth that ear, nose, and throat clinics rely on surgical procedures. The doctors working there are not general practitioners but surgeons, and their preference is undoubtedly to conduct as many operations as possible. So, we must face the unsettling reality that these doctors are acutely aware of the harm they inflict when they cut away or burn the delicate nasal turbinates, They would never subject themselves to such a procedure, but when it comes to operating on others, they appear to be totally fine with it. In their quiet moments, as they return home after a day's work, what do they see when they gaze into the mirror? What reflection of their own conscience do they confront? Do they see an angel, tirelessly helping people with nasal congestion, or do they see a devil, wreaking havoc in people's lives? And when they lay down to sleep, are they haunted by the knowledge that they have caused great pain and suffering to countless individuals? And if they are conscious of this, do they find solace in their slumber? In my conviction, most surgeons are fully cognizant of the harm they inflict upon their patients, yet they choose to turn a blind eye. Despite their high IQs, many probably lack emotional intelligence. They fail to empathize with the suffering of their patients in a way that most would consider normal. They seemingly disregard the harm they cause, focusing solely on performing numerous and extensive operations to increase their own income. They exploit the flaws in the healthcare system, knowing they are shielded from consequences, even if they were to remove every last nasal turbinate. The fact that their actions may be tantamount to a crime against humanity holds no sway over them, as long as their paycheck remains intact. Now, as we reach the conclusion of this first part of the documentary, I implore you to bear with us as we delve deeper into how these operations decimate the individual. But before we proceed to part 2, I want to bring your attention to our support group for individuals battling empty nose syndrome and similar afflictions. The group's name is Empty Nose Syndrome, Iatrogenic Nasal Dysfunction, the World Group. For those affected or their loved ones, this group serves as a sanctuary where they can find solace and gather valuable information by connecting with others facing similar challenges. At the time of this video's production, the group has grown to include approximately 800 members, a testament to the urgency of this issue. The group is led by individuals who have experienced the pain of ENS firsthand, as opposed to being controlled by doctors, unlike another well-known ENS group on Facebook. The link to the group will be found under the video description. Now let's move on to part 2 of this video, where I'll provide a more detailed explanation of the effects of septoplasty and turbinate reduction, and how these operations negatively influence both the nasal lining and the body's autonomic nervous system. To begin with, I'll clarify the frequent observation that ENS tends to emerge sometime after the surgical procedure. One aspect that many find challenging to comprehend is that ENS can manifest immediately after nasal surgery, or gradually over time. It is not uncommon for affected individuals to experience significant problems several years after the initial operation, making it difficult for them to establish a connection between their issues and the surgery itself. This lack of immediate correlation can be attributed to the fact that the surgery disrupts the nose's natural ability to maintain a moist and healthy nasal lining. Over time, the mucosa can degenerate due to its own dryness. The duration of this degenerative process, if it occurs at all, depends on various factors. These include the extent of tissue damage during surgery, to how open the nose is after the procedure, and to the functionality of the nasal cycle, which normally allows each nostril to rest and recover in shifts, preventing wear and tear on the nasal lining, and to the environmental conditions in which one resides. For instance, living in a dry and warm area can potentially accelerate the degradation process. Furthermore, a surgical procedure on the turbinates and on the nasal septum often results in a diminished immune system within the nasal cavity. This is due to a combination of the nose being too open and due to the removal or destruction of tissue that contains goblet cells. Goblet cells are cells that are responsible for producing secretions in the nasal lining that contains antibacterial substances such as lysozyme, lactoferrin, nitric oxide, and antibodies. These substances possess potent antibacterial and antiviral properties. It is not uncommon for affected individuals to experience infections in the nasal lining at a later stage. These infections can further contribute to the destruction of the mucous membrane. exacerbating the impaired sensation of airflow and increasing dryness as more goblet cells are destroyed in the process. After conducting thorough research on this condition for over 5 years, which involved interviewing and studying the experiences of hundreds of patients, I can confidently affirm that the majority of individuals affected by ENS suffer from significant sleep disturbances. Many find themselves unable to sleep for more than 1 to 3 hours at a time before waking up due to shortness of breath or a severely dry nose. This is despite resorting to sleeping pills, which are often taken out of necessity to sleep at all. It's also important to mention that these medications can worsen the existing issues with nasal dryness resulting from the surgery due to their anticholinergic effects.
Listen up, yo, to a story of despair. Empty nose syndrome, a nightmare we share. Greedy surgeons with hearts so cold, left us suffocating with noses that turn to a hole. But we won't stay silent, we'll fight for our voice. Depose these surgeons who left us with no choice. Empty nose syndrome, a battle we'll face. Together we'll rise, reclaiming our space.
What distinguishes this condition is that it can only be directly acquired as a result of surgery. However, some surgeons may attempt to attribute it to poor healing. Unfortunately, this is a lie told to shift responsibility from the surgeon to the patient. In reality, the surgery itself is entirely responsible for the injuries and the subsequent development of the condition. The more aggressive the surgeon's approach is, involving tissue removal, resection, or cauterization within the nasal cavity, the greater the challenges the patient will face, either directly or in the future. It is crucial to recognize that during the operation, the surgeon intentionally destroys or removes tissue within the nose, tissue that has a high concentration of sensory neurons. This results in the destruction or elimination of the nerves responsible for sensing airflow in the nose. The absurd thing, though, is that when patients return to the surgeon with post-operative problems, such as lack of airflow perception in the nose, air hunger and suffocation, it is not uncommon for those surgeons to claim that their problems are mental or due to poor healing. However, such claims are as absurd as suggesting that a patient's inability to walk after their left leg has been amputated is due to their poor healing ability. This type of explanation constitutes the highest form of medical gaslighting. Similarly, it's also the highest form of gaslighting to claim that a patient cannot have ENS because their turbinates are not completely gone after a coblation. As we know, ENS is mainly a nerve-related condition, and those nerves can easily become destroyed from the heat during the process. Now, let's delve into the next topic and explore how the ear, nose, and throat clinics function. It is essential for you, as a patient, to grasp this understanding before consenting to surgery. What distinguishes a visit to a local ENT doctor is that they are primarily surgeons, rather than general practitioners with a specialized focus on investigating the underlying causes of nasal congestion on a holistic level. From the outset, you are likely to encounter ENT doctors whose primary role within the department is to perform nasal surgeries, regardless of the actual necessity. In reality, a significant portion of the ENT department's activities revolve around surgical interventions, and the entire business model relies heavily on these procedures. To maintain their annual budget from the state, a certain number of patients must undergo surgery for nasal congestion each year. A decline in the number of such operations would result in a reduction of the department's budget over time, potentially leading to redundancies among the surgeons. It is worth noting that many surgeons now operate as independent consultants, providing their services to the hospital. Consequently, they have a personal financial interest in performing numerous and extensive operations. Furthermore, it's important to understand that management positions in the ENT clinics are typically occupied by the most highly educated individuals. Since surgeons are often the most highly educated, they also tend to become managers. Consequently, this further amplifies the emphasis on surgical interventions. So, unfortunately, the way the system is structured has significant and detrimental implications for individual patients. This is primarily due to the desire to increase the number of patients undergoing surgery. As a result, there is a tendency to refrain from investigating the real underlying cause of nasal obstruction. The reason for this is that such a study would likely show that a large majority of patients could potentially have avoided surgery by opting for natural treatments instead. Now, let's look at some causes for nasal congestion. There are numerous systemic causes in the body that can lead to congestion, and it's important to note that not all cases require surgical intervention. The purpose of this video is not to delve into all the potential causes, as you can find this information yourself online. However, we can briefly touch upon some frequently encountered causes before proceeding. Some common causes of congestion include allergies with activation of antibodies, such as immunoglobulin A and E, food intolerance with activation of antibodies such as immunoglobulin G, inflammatory conditions in the body such as autoimmune diseases, and exposure to mold, dust, pollen, or other irritating substances in your immediate environment. Hormonal changes, particularly during pregnancy when estrogen levels rise, can also contribute to nasal congestion. Additionally, a deficiency of the DAO enzyme responsible for breaking down histamine, a substance that can cause nasal congestion, can lead to this condition. Prolonged use of nasal sprays is another cause, as the spray itself irritates the nasal lining, leading to increased blood vessel growth over time to compensate for the chronic lack of blood supply. Preservatives used in nasal sprays have also been shown in studies to have cell-damaging effects, further irritating and damaging the mucous membrane. Moreover, certain foods and beverages can cause nasal congestion in some individuals. Foods and drinks high in histamine, sulfites, or tannins are known culprits. Foods stored for a long time, such as aged cheese, canned tuna, fermented dairy products, and non-fresh fish and shellfish, tend to have higher histamine levels. Canned foods and processed meats should also be considered. Similarly, wine and beer are known to cause nasal congestion. Processed foods, unhealthy oils, and deep-fried foods like French fries can also contribute to secondary nasal congestion by triggering increased inflammation in the body. It's worth noting that even healthy foods can cause problems if you have a personal intolerance to them. So it may be beneficial to undergo a food intolerance test, searching for IgG antibodies. For faster testing of immediate allergy reactions, you should test for IgA or IgE antibodies. However, IgG reactions may occur hours to days after exposure. Therefore, it's generally preferable to test for these antibodies first. It's hard to notice these types of food intolerances yourself due to the delayed reaction. As you can see, there are numerous natural causes of congestion that can be treated without resorting to surgery. However, ear, nose, and throat clinics primarily focus on surgeries, often neglecting to conduct these tests. Performing such tests would likely reduce the number of patients undergoing surgery. Unfortunately, from the perspective of trained surgeons, this is not desirable. On the contrary, these surgeons tend to promote surgery, even if it's not necessary for the patient, just to keep the business running. They do this through several questionable approaches that we will explain and discuss later in this video. Now, a question for you. If you've come across this page, chances are you've experienced nasal congestion at some point and found it bothersome. But have you thought about why it's so challenging? Have you ever wondered why it feels exhausting and stressful to have a blocked nose? Have you ever pondered why it's difficult to sleep when your nose is congested? I mean, you have the option to keep your mouth wide open and breathe through it, which should provide more than enough air. Isn't it a bit peculiar, then, that breathing through the mouth can still be difficult? This is where the first deception and lack of information from healthcare providers become evident. In reality, breathing through the nose stimulates the parasympathetic branch of the autonomic nervous system. This part of the nervous system promotes relaxation, recovery, digestion, healing, and other restorative processes. On the contrary, breathing through the mouth stimulates the activation of the sympathetic nervous system. This is the branch that dominates during periods of activity, such as when we are moving, walking, running, exercising, or just being generally physically active. During nasal breathing, the nerve endings in the mucous membrane, also known as receptors or sensory neurons, are stimulated by the airflow passing over them. These receptors serve as the body's sensors and can be likened to the sensors found in a self-driving car. Similar to how these receptors provide information to the car's control system, enabling the control computer to interpret the surroundings and issue appropriate commands, such as braking, accelerating, or turning. The receptors in the nasal mucous membrane operate in a similar manner. They gather information related to breathing and the nasal passages, which is then transmitted to the brain's respiratory center through the fifth cranial nerve. Once in the brain, this information is processed, and the brain can choose to respond or remain passive, depending on how best to handle the current situation. There are various types of receptors in the nose, each responsible for detecting different stimuli and conditions as airflow passes through the nose. To keep this video concise, we won't delve into all of them and their specific functions. However, it's important to know that the mucous membrane contains a high concentration of parasympathetic nerve fibers, which are connected to the brain through the fifth cranial nerve. These fibers are sensitive to various stimuli, including airflow and temperature changes within the nasal cavity. When these nerve fibers are stimulated by inhaling through the nose, a parasympathetic response is triggered, promoting relaxation and a sense of well-being. Breathing through the nose can be likened to a soothing massage for the brain and the parasympathetic nervous system. This is why many meditation practices emphasize calm, deep breathing through the nose. Nasal breathing facilitates the body's ability to maintain control over the calming aspects of the autonomic nervous system, supporting healing, recovery, digestion, sleep, and relaxation. Numerous studies have also demonstrated that nasal breathing enhances cognitive function, improves decision-making abilities, and enhances memory. These benefits are linked to the mechanical stimulation of the parasympathetic nerve fibers within the nasal lining when airflow moves along the mucous membrane. Before you undergo a nasal operation, it's crucial to grasp that such a procedure doesn't solely impact the nose. It's like I always say, a nose surgery is not just a surgery on the nose, but also a surgery on the autonomic nervous system. So how is this? Well, even though surgeons may not explicitly state it, all surgical procedures on the turbinates are intended to partly or totally destroy them in one way or another. This can be done using heat-based techniques, such as coblation or radio frequency, or by surgically resecting them, either partially or completely. I have previously created a YouTube video discussing how heat-based methods can damage the lining of the turbinates, so I won't delve into the details here. Instead, I recommend you watch my previous videos. I will leave a link in the video description below. In short, it's important to note that the sensory neurons responsible for detecting airflow are located on the surface of the turbinates. When these turbinates are subjected to heat-based methods like coblation, the fine nerve fibers on the surface of the turbinates are also destroyed. The nasal lining of the turbinates transforms into scar tissue, resulting in a complete loss of airflow sensation in that area. The same outcome occurs when the turbinates are completely removed through cutting. This, of course, guarantees a permanent loss of all types of receptors in that region. Although there may still be a nerve connection to the brain via the fifth cranial nerve deep inside the nose, the external nerve fibers that would detect airflow on the surface of the turbinates are now absent, along with the turbinates themselves. Consequently, while the nerve connections to the brain may remain, the brain is unable to receive any airflow-related information from this amputated area, and the affected person will no longer be able to sense the airflow in this region. And if a large enough area is affected, paradoxical obstruction and air hunger will be the irreversible result. So the question that arises is, how much tissue can be burned and removed before the brain loses its nerve signals from the nose? The answer to that question can only be known by the patient a few years after the surgery. No surgeon can provide any guarantee in advance or determine an individual's personal limit in this regard. Additionally, it's important to note that the turbinates serve other functions that are lost when they are surgically treated. On the surface of the turbinates, there are goblet cells responsible for producing secretions containing antibacterial substances. These secretions keep the mucosa moist, healthy, and protect it from infections. If the turbinates are cut off or reduced in size, this vital function is also destroyed. Similarly, the surface of the turbinates is lined with small hairs called cilia. These hairs have an important function in clearing the nose of dust, particles, bacteria, and old secretions by moving them backward towards the pharynx through rhythmic movements. From there, they are swallowed and neutralized in the stomach acid. If the turbinates are cut off or reduced in size using heat methods, this ability is also reduced in effectiveness. Furthermore, the turbinates have other functions. One of these functions is to increase the surface area of the nasal lining, providing better humidification and heating of inhaled air, while improving the filtration of unwanted particles from reaching the lungs. The increased surface area of the nasal lining due to the turbinates also allows more goblet cells in the same area, helping to keep the nose moist and free from infections. Additionally, as previously mentioned, the nasal turbinates are involved in a function known as the nasal cycle. This cycle involves alternating airflow between the left and right nostrils, allowing one side of the nostrils to rest while the other side takes over the job. This mechanism ensures consistent breathing resistance while allowing recovery and healing of the resting nostril. So, by removing or reducing the size of the turbinates, the nose will stay open 24/7. During my research journey, I've encountered scientific studies revealing distinct connections between sensory nerve fibers in each nostril and the corresponding brain hemisphere. For instance, it's been observed that breathing through the left nostril stimulates the right hemisphere, primarily associated with emotional and creative processes. Furthermore, it's been observed that left-side nasal breathing can increase activity in the limbic system, including the amygdala. This, in turn, can have an impact on emotions and on the stress response. Similarly, the stimulation of corresponding sensory nerve fibers in the right nostril can activate the left hemisphere, known for its involvement in analytical thinking, language, and logical processes. Studies have also unveiled that right-side nasal breathing can influence activity in both the prefrontal cortex and the temporal parietal area. These influences can affect concentration, attention, and cognitive functions. All these findings underscore the fact that sensory neurons in the left and right nostrils have distinct connections to the brain. With this understanding, it becomes clearer that a nose operation isn't solely a local procedure, but also an intervention on the brain and nervous system. In fact, a nasal surgery holds the potential to alter an individual's personality and functioning to a certain extent. Based on extensive research involving thousands of hours, I can confidently state that many individuals with empty nose syndrome face difficulties with cognitive functions, such as attention, concentration, and memory. So, to address the initial question, why is mouth breathing challenging when the nose is congested? The explanation is rather straightforward. The sensory neurons in the nose, linked to the parasympathetic nervous system and to the brain, are mechanically unable to be stimulated by airflow during congestion. Consequently, the brain lacks the necessary signaling, resulting in a sensation of breathlessness and tension. So, now that you're aware of this nose-brain nerve connection, it raises a crucial question. Is it truly beneficial to surgically remove or burn these sensory neurons in the nose? Clearly not, because when a significant number of these neurons are destroyed, the individual will perceive a sensation of air hunger and stuffiness, even if the nose is technically open. Furthermore, it's important to note that the turbinates play a role in converting laminar airflow into turbulent flow due to their shape, size, and location. This occurs as the air encounters the front part of the turbinates. This is important because turbulent flow enhances the dispersion of scent molecules, resulting in an improved sense of smell. Additionally, it boosts the perception of airflow and prolongs the contact time between inhaled air and the mucous membrane. This enables better moisture retention and warming of the inhaled air, which is vital for proper gas exchange in the lungs. The turbinates also ensure that the air is warmed and moisturized before it reaches the back of the nose and throat. When the turbinates are significantly reduced or removed, individuals often experience dryness and discomfort in the throat and posterior region of the nose. Moreover, the turbinates decrease the open diameter of the nasal cavity, creating a Venturi effect that results in increased airflow velocity. To elaborate on this effect, air enters the nose through the wider outer part of the nostril, resulting in a relatively low flow rate. As the air reaches the front section of the turbinates, where the nasal cavity's diameter is narrower due to the presence of the turbinates, the flow rate increases. This increased flow rate helps the nerve endings in the nasal mucosa sense the airflow better. To test this, you can inhale forcefully through your nose. Doing so will lead you to experience an intensified sensation of coolness in your nasal passages. This demonstrates that the thermoreceptors in the nasal lining are activated to a greater extent when the airflow increases. Furthermore, when the turbinates are resected or significantly reduced, the open volume within the nose becomes significantly larger, which slows down the speed of the inhaled air. The normal turbulent flow is consequently transformed into a laminar flow that often moves predominantly along the nasal floor. These factors combined further diminish the affected person's ability to sense airflow within the nose. It is also important to note that each nostril is equipped with 3 turbinates: the inferior, middle, and superior turbinates. These turbinates play a crucial role in distributing airflow between themselves. For example, when the lower turbinate is resected or reduced, the air tends to follow the path of least resistance on the way to the lungs, which is primarily along the nasal floor. Consequently, the airflow directed towards the upper regions of the nose, including the middle turbinate, the septum's swell body, and the upper turbinate, decreases. Thus, the reduction or removal of the lower turbinates can lead to a decreased perception of airflow in other parts of the nose, even when no surgery was performed in this area. The inference we can draw from this is that while the nerve component is the primary reason for empty nose syndrome, it's not the sole factor. In certain cases, the altered airflow pattern in the nose also contributes to the diminished perception of airflow. So, we have now discussed the implications of turbinate surgery on breathing problems, such as shortness of breath and disrupted nasal airflow patterns. However, we have yet to delve into the consequences of nasal septum surgery, which can have similar effects. Many individuals mistakenly believe that only turbinate surgery can lead to breathing problems, mucosal dryness, and ENS. However, the reality is that any nasal operation that impacts the mucous membrane can result in a diminished ability to perceive nasal airflow. The key question remains: how much tissue can be damaged before the problems become so extensive that the brain no longer receives adequate information regarding nasal breathing? One thing is certain, regardless of whether it involves the turbinates, nasal septum, or other nasal mucosa. The more the mucous membrane of the nose is compromised by surgery, the higher the likelihood is of experiencing dryness, numbness, and ENS symptoms. A combined procedure, involving both the nasal turbinates and the nasal septum, significantly raises the probability of encountering problems. It is also important to note that it is quite common for a nasal septum surgery to be accompanied by the removal of portions of the lower turbinates, often without proper patient notification. Personally, I underwent a nasal septum operation and had a significant portion of my inferior turbinates removed, all without my knowledge. I've also heard many similar stories from other individuals. Now let's discuss how nasal septum surgery can lead to problems associated with empty nose syndrome. Firstly, it's important to understand that having a deviated nasal septum is considered normal. Approximately 80% of the global population has a nasal septum that is somewhat deviated. Most individuals are born with this condition, and as a result, the turbinates adjust their shape and size to accommodate the available space in each nostril. Consequently, the turbinates become larger on the concave side and smaller on the convex side. In most cases, this adaptation provides balanced airflow in both nostrils, even when one nostril has a concave side of the septum. Therefore, a deviated nasal septum is often not the primary cause of nasal congestion. So, what can happen during a septoplasty? In my previous lecture, I explained in detail how such an operation can damage the nasal lining of the septum. If you want a more in-depth understanding, I recommend watching my previous video. The link is provided in the video description below. However, I'll briefly mention a few things here that have a high likelihood of occurring. Firstly, it is common for nasal septum surgery to alter the external shape of the nose, typically in a negative way. The nose may become crooked and uneven, and there is a high probability of experiencing a collapse of the nasal valve. Not only is this visually unappealing when one or both nostrils collapse, but it also has a significant negative impact on breathing and the perception of airflow. When the nasal valve collapses, the airflow is partially or completely obstructed toward the upper part of the nose. It then becomes more challenging for the air to reach the septal swell body, which houses many sensory neurons. Additionally, it becomes more difficult for the air to reach the middle turbinate and upper turbinate, as well as the upper part of the nose. This greatly reduces the sensation of having an open nose and comfortable breathing, which can lead to problems like shortness of breath, even when no tissue has been cut or damaged. It's also worth mentioning that correcting a collapsed nasal valve is an extensive and highly invasive procedure. I've come across numerous stories where the surgery to fix it resulted in even bigger problems than the original issues. In addition, it is imperative to emphasize that during a septoplasty, it is necessary to detach the mucosa from the cartilage wall. It is critical to perform this detachment while maintaining both the mucosa and perichondrium as a unit. The perichondrium acts as a connective tissue membrane that lies between the septal wall and the mucosa. This particular step is of immense importance due to the delicate nature of the mucosa, which is very susceptible to tearing. Unfortunately, there are instances where surgeons fail in this essential aspect, which greatly increases the risk of mucosal injury. Even if the surgeon successfully detaches both the mucosa and the perichondrium together. There are instances where some surgeons exert excessive force during the process, leading to the tearing of the delicate mucosa. Once the mucous membrane is torn, nerves and blood vessels are severed. The mucosa now loses sensation partially or entirely, and the larger blood vessels that traverse the mucosa are disrupted and unable to reconnect. Only the small capillaries remain. As a result, the mucous membrane loses its erectile function and becomes paper-thin and fragile. With the loss of larger blood vessels, the mucosa becomes dry and loses the ability to swell and contract in harmony with the turbinates. This leaves the nasal passage overly open, negatively affecting the perception of airflow, as described before. Moreover, if the surgeon removes cartilage from the nasal septum, further widening the nasal passage, this impact is intensified. Now, let's continue to talk about the organ called the septal swell body. This organ is located in the front of the attachment of the middle turbinate and serves a similar function to the turbinates themselves. Sometimes it's even referred to as the fourth turbinate of the nose. This region of the nose and this organ contain a significant number of sensory neurons that play a crucial role in detecting airflow and ensuring a comfortable breathing experience. The septal swell body is also rich in goblet cells, which produce secretions that maintain the mucous membrane's moisture, health, and infection-free state. However, nasal septum surgery often results in partial or complete destruction of this area. The likelihood of damaging the area is higher when the mucous membrane is detached from the septal wall near this region, or when the surgeon tears the connecting blood vessels and nerves during the procedure. Additionally, it is important to mention the significance of the perichondrium, which lies between the cartilaginous wall and the mucous membrane. This membrane plays a vital role in providing blood supply and nutrients to the cartilage cells of the nasal septum. If the perichondrium is torn off on both sides of the nasal septum, the cartilage cells will perish. As a result, a hole may develop in the septum sometime after the surgery. The size of the hole can vary depending on the extent of the affected area. In severe cases, the hole may become so large that both nostrils essentially merge into one. This weakens the strength and structure of the septal wall, often leading to a nasal valve collapse. Consequently, the septal perforation may lead to disrupted airflow in the nose, and the hole can also give rise to whistling sounds during breathing. As you can see, a septoplasty can cause significant and lifelong problems that surgeons fail to inform about. So let's examine the impact on gas exchange after intranasal surgery that excessively opens the nose and destroys the nasal lining. Along the mucous membrane of the nose and in the sinuses, nitric oxide is produced, which has a dilating effect on the lung vessels, implying an improved gas exchange in the lungs. It's worth mentioning that low levels of nasal nitric oxide have been found among individuals with ENS. More on this can be read in Eugene Kern's book about empty nose syndrome. Furthermore, when nasal passages are unnaturally widened through surgery, air flows in and out too quickly, causing hyperventilation. Additionally, nerve and receptor damage can create a sensation of air hunger, disrupting the natural pause between exhalation and inhalation. This further increases ventilation, leading to excessive carbon dioxide loss. As a result, CO2 levels in the blood drop too low, a condition known as hypocapnia. Carbon dioxide is a crucial regulator in the body, acting as a natural vasodilator to maintain proper blood flow and oxygen delivery. However, when too much CO2 is lost, blood vessels constrict, reducing circulation and impairing oxygen transport to tissues. One of the most concerning effects of low blood CO2 is the Bohr effect, a phenomenon where hemoglobin holds onto oxygen more tightly, making it harder for oxygen to be released to cells. This leads to chronic functional hypoxia, meaning that, despite normal oxygen levels in the blood, tissues receive insufficient oxygen. As a consequence of this oxygen deficit, the body may shift toward anaerobic metabolism, leading to an increase in lactate levels. To compensate for impaired oxygenation, the body may also increase hematocrit and mean corpuscular hemoglobin concentration over time. Hypocapnia also leads to alkalosis, a condition where blood pH becomes too high. This imbalance can cause electrolyte disturbances, such as low ionized calcium and potassium levels. Chronic alkalosis further disrupts the body's acid-base balance, prompting the kidneys to excrete bicarbonate in an effort to restore equilibrium. These disruptions can affect nerve function, muscle contractions, and cognitive processes. Additionally, reduced blood flow to the brain due to vasoconstriction may contribute to brain fog, dizziness, and cognitive dysfunction. While hyperventilation is the most common respiratory response to turbinate and mucosal injury, its effects on breathing regulation can be complex. According to this study, nearly 80% of empty nose syndrome patients experienced hyperventilation. However, in some cases, the opposite pattern, nocturnal hypoventilation, has also been observed. This appears to occur because reduced nasal airway resistance impairs diaphragm function and lung expansion. As a result, instead of having too little CO2 in the blood, there is too much, leading to hypercapnia and acidosis, where the blood becomes overly acidic. So, what I want to convey is this. All nasal surgeries that excessively open the nose and impair the sensory function in the nasal lining result in a disrupted breathing pattern. Frequently, we observe an elevated respiratory rate and shallower breathing. Now, let's delve into Eugene Kern's insights on nasal resistance and its impact on pulmonary gas exchange. When we inhale, a negative pressure is generated within the lungs, establishing a suction effect that facilitates the flow of blood to the lungs and heart. To ensure the efficacy of this process, normal nasal resistance is crucial. However, when the normal resistance in the nose is lost due to surgery, the suction effect is reduced. With less blood flowing through the lung vessels, there is a negative impact on oxygen uptake and the clearance of carbon dioxide. Additionally, the diminished negative pressure adversely affects the opening of peripheral bronchioles in the lungs, further exacerbating the situation. Moving on to a key observation derived from Jim Bartley's report. Nasal pulmonary interactions. The breathing cycle consists of inspiratory and expiratory phases. A prolonged expiratory phase has been demonstrated to stimulate the vagus nerve and the parasympathetic nervous system, inducing a sense of inner calm. If the nasal airway is excessively opened, it results in a shortened expiratory phase, potentially reducing the calming effect on the body and mind. So let's now summarize how reduced nasal air resistance can impact pulmonary gas exchange and the overall health. First, I want to provide an image of what normal breathing looks like. Optimal breathing at rest involves approximately 6 to 12 deep breaths per minute, with inhalation lasting 2 to 3 seconds and exhalation 3 to 4 seconds. Afterward, an automatic pause should occur for 2 to 3 seconds before the next inhalation begins. When the nasal cavity is unnaturally opened, it disrupts the resistance function of the inner nose. This disturbance impacts the natural breathing rhythm just described. Both inhalation and exhalation become too rapid, and the lungs do not fill to the same extent. The activation and movement of the diaphragm decrease, resulting in what is called chest breathing, a phenomenon that has several negative impacts on physical and mental health. Now let's explore nerve-related factors that trigger respiratory distress and have a negative impact on pulmonary gas exchange. To achieve satisfactory respiration and inner calm, there must be a functioning sensory ability in the nasal lining that can detect airflow. If this ability is impaired, the individual will experience air hunger and a sense of breathlessness. Furthermore, when the sensory function of the nasal lining is impaired, it distresses the brain. In response, the autonomic nervous system strives to alleviate the situation by increasing the respiratory rate. As the frequency rises, breathing tends to become shallower, and the natural pause between exhalation and inhalation is often found to be absent. For some individuals, the reduced capacity to perceive nasal airflow prompts a more forceful inhalation, aimed at increasing airflow velocity. This is because increased airflow velocity more effectively activates thermoreceptors in the nasal lining, subsequently alleviating the sensation of air hunger. Unfortunately, this autonomic process of inhaling more forcefully is counterproductive, as it further disturbs pulmonary gas exchange and contributes to an even stronger sensation of air hunger. Furthermore, ENS is often associated with pain in the nose during inhalation, which may lead to a behavior of shortening the breath to alleviate the discomfort, thus further worsening the situation. Now, I will delve into the issue of healthcare providers frequently concealing the truth regarding the consequences of these operations. Let's begin by examining the preoperative information I received prior to my surgery. This particular document was provided by the main ENT clinic situated in the town of Borås, Sweden. Regrettably, the document is not available in English, but I will provide an explanation of the pertinent section for your understanding. Let's examine the document on the right-hand side. Notice the section, which solely covers risks and complications. The text consists of 3 succinct sentences conveying the following information.
Nasal discharge mixed with blood is a common occurrence during the initial days following surgery. It is also possible to experience coughing with bloody mucus. To handle minor bleeding, it's advisable to assume an upright position, consume cold water, and find relief by applying an ice cube or indulging in ice cream. Complications that may arise in rare cases include significant bleeding, swelling around the eye, increasing pain, or the onset of a fever exceeding 38 degrees Celsius. If any of these symptoms occur, it is imperative to promptly communicate with the hospital using the provided contact number.
As you can see, not a single word about the extensive consequences I have discussed thus far. Let's now compare this with other risk-related information disseminated in other areas of society. A while ago, I owned stocks in Alimac Group, and when they intended to issue new stocks to investors, they provided us with the following risk information. Let's scroll down and observe the length and depth of the content. So that's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. 13 pages. The document comprises an extensive 13 pages examining the risks faced by investors, and at the same time, it's deemed acceptable for ENT clinics to provide merely 3 sentences of risk-related information. This, when a respiratory organ is about to get irreversibly destroyed. What's even more alarming is that this issue transcends the borders of Sweden. Conversations with people from various corners of the world have revealed similar experiences. Unfortunately, one cannot rely on healthcare providers to offer this vital information. This is why I have taken the initiative to create this video and this podcast, ensuring that you receive accurate information about risks and consequences. It really would have been reasonable for healthcare professionals to honestly inform patients about the potential consequences of such an operation, allowing them to make an informed decision. However, the failure to provide this information seems to serve the purpose of increasing the number of patients undergoing surgery. Now, let's look at the statistics. How common is it to experience problems with the nose and breathing after a complete resection of the inferior turbinates? The image below shows a compilation of some follow-up studies conducted on different types of surgery to the turbinates to alleviate nasal congestion. This compilation, titled The Diagnosis and Management of Empty Nose Syndrome, was assembled by Dr. Stephen Hauser. I will provide a link to the full article under the video description for those interested. Let's focus on one of the studies mentioned in the article, specifically the one by Moore et al., 1985. The findings reveal that patients who had their entire inferior turbinates removed experienced significant problems within a few years after the operation. The follow-up assessments took place between 2 and 7 years after the surgery. The results indicate that within this period, 89% of the patients developed issues with dryness and crusting of the remaining mucosa. Additionally, 66% developed atrophic rhinitis, a degenerative condition caused by dryness that leads to mucosal degeneration. Furthermore, 22% of the patients experienced azena, a type of atrophic rhinitis characterized by foul-smelling crusting in the nose, often attributed to the bacterium Klebsiella. In summary, it can be concluded that approximately 9 out of 10 patients who underwent the procedure experienced problems with dryness and crust formation in the remaining mucosa. Around 7 out of 10 patients developed atrophic rhinitis, and approximately 2 out of 10 individuals developed ozena. How can it be acceptable for the healthcare system to perform these operations without fully informing patients about the potential consequences, especially when the likelihood of experiencing such problems ranges between 20 and 90%? Now let's proceed with the video, delving into the tactics employed by surgeons to persuade patients to undergo a septoplasty or turbinate reduction. What they often do is assert that nasal congestion results from excessively enlarged nasal turbinates, suggesting that surgery or cauterization is necessary to restore normal breathing. This raises the question, How many other organs in the body uncontrollably grow excessively? Can you think of any? No? I guess not. Because that's not how the body works. So let's delve into the subject and explore the methods surgeons use to convince patients to undergo surgery, even when it's unnecessary. When a new patient arrives, the first step is to refer them for an X-ray. Often, the images reveal a deviated nasal septum, which surgeons argue requires surgical correction. As you may recall, approximately 80% of the population has some degree of septal deviation. However, this crucial information is deliberately withheld from the patient, allowing the surgeon to attribute nasal congestion solely to the crooked septum and recommend surgery. If they can't substantiate this claim but still want to proceed with surgery for a new client, they employ an alternative approach. They use the same X-ray images to argue that one or both nostrils possess excessively enlarged turbinates requiring reduction. Of course, this is not true. All organs in the body have predetermined sizes and do not continue growing indefinitely once a person reaches adulthood. The crucial aspect about turbinates is their composition of intricate blood vessels that meander through them. These blood vessels can contract or expand in diameter, responding to signals transmitted by the autonomic nervous system. Consequently, the turbinates can undergo significant changes in size. The transition from an enlarged state to a small state results in a significant difference in size, spanning several multiples. However, it's important to note that if an individual experiences allergies, food intolerance, or ongoing inflammation within the body, the turbinates respond by swelling. This swelling, in turn, leads to nasal congestion. Contrary to the surgeon's beliefs, the solution does not lie in surgically removing the turbinates themselves. Instead, it involves addressing the underlying cause responsible for their swelling. Unfortunately, the issue at hand is that surgeons fail to provide this vital information to their patients. Instead, they use X-ray images to claim that the turbinates have grown too big and now need to be reduced. Furthermore, they neglect to inform you about the phenomenon known as the nasal cycle. Here's what they do. They swiftly capture an X-ray image of your nose for a mere fraction of a second. Subsequently, they present these images to you, asserting that one of your nostrils has excessively large turbinates that require size reduction. However, this investigative approach is deeply problematic because it fails to account for the expanded space in the same nostril when the turbinates have decreased in size due to a shift in the nasal cycle. Now, let's turn our attention to the displayed images and compare them. Firstly, look at image A on the left side. In this image, you can clearly see that the inferior turbinate on the right-hand side looks overly congested. Now shift your focus to image B on the right side, specifically to the inferior turbinate on the right-hand side. This image was likely captured a few hours later. What do we observe now? The same turbinate, which was previously overly congested, is now remarkably open. Notice the black area surrounding the turbinate itself. That's the open space for air to pass. Now it becomes evident that there has been a shift in the nasal cycle, providing enough room for air to freely pass the turbinate. And this is likely how your own X-ray results would have appeared if the doctors had taken the initiative to capture your nose at different stages of the nasal cycle. Now you understand the essence of my point. The doctors fail to explain this to you. Instead, they only show you the image that portrays the oversized turbinates, compelling you to believe that size reduction is imperative. Consequently, the healthcare system manipulates patients into proceeding with surgery, even when it's obviously unnecessary. In conclusion, it is important to realize that ENT doctors are primarily motivated in their profession by generating significant profits through performing a large number of surgeries. They prefer surgical procedures for nasal congestion and perceive your body as raw material to manipulate, all with the ultimate goal of financial gain. Additionally, they benefit from significant legal protections that free them from having to disclose the risks and complications associated with their surgery. Surprisingly, in many countries, they are not even required to provide information about the surgical process itself, as they cannot be held legally responsible for any injury that might occur. Since they are free from responsibility, they also lack the incentive to voluntarily inform you about complications that can arise after the surgical intervention. Moreover, in the field of surgery for nasal congestion, there is a lack of standardized methods that surgeons must follow. Instead, they are free to use any method they like at the moment, as long as they can claim that this method is based on proven experience and scientific evidence. However, such claims lack support. There is a lack of long-term patient follow-up, extending several years after surgery, and no new systematic assessment is done to determine the relative safety of different methods. Surgeons often follow outdated techniques that were approved decades ago, despite new research highlighting widespread problems associated with these approaches. Currently, any method of turbinate reduction is considered acceptable, whether it involves a minor removal of 5% of the lower turbinate or a complete excision of both the middle and inferior turbinate. All measures to correct nasal congestion surgically are considered acceptable. This is true regardless of whether they involve burning of the turbinates or whether it involves removing the turbinates entirely with scissors. It is remarkable that the medical establishment approves of all these approaches, despite research showing severe suffering among the affected individuals.
Happy birthday!
Furthermore, there is a low possibility for patients to claim malpractice or to seek compensation if the surgeon deviates from the initially agreed procedure. Surgeons can always claim in retrospect that unforeseen circumstances arose during the operation, which justifies an increased scope. For example, they may claim that the nasal cavity was narrower than originally expected, necessitating the removal of more nasal mucosa than initially agreed upon. In Sweden, it is also more or less impossible to sue the surgeon himself. Instead, you have to sue the hospital, something that is very difficult to succeed in. If you still have doubts about the credibility of this information and are considering surgery as a solution for your congestion, I urge you to take a few more moments to read and listen to the stories of individuals who have already suffered harm. Listen to their experiences and try to empathize with the pain they endure. Take a final pause and seriously contemplate whether you genuinely want to expose yourself to an operation that could devastate your life, especially when there are alternative natural treatments accessible. Now let's begin with a YouTube video showcasing a patient who underwent turbinate surgery with a devastating effect on his life.
Hello Dr. Song, hello Jay, hello G&G. Here I'm in Germany in a hospital. They will try to make me better, but it's still maybe not possible, I don't know. It's flip a coin, and yeah, I suffered day by day because your surgery, Dr. Song. You make 2 holes in my nose, and now you can put a train inside or a truck, and I cannot sleep. I feel energyless and hopeless, and I ask myself all the time why I come to Korea to G&G. Have a nice day.
Alright, it's time to wrap up this video. By now, you should have enough information to make an informed decision about whether to proceed with a nasal operation or not. You should also have a basic understanding of empty nose syndrome. If you want more information, I recommend checking out the following 3 blog posts. They're originally written in Swedish, but you can translate them directly on the blog by clicking the translation button at the top left of the side menu. In time, these posts will be translated into English. Links can be found under the video description. The first post mainly covers nasal septum surgery and how it can lead to ENS. The second post discusses methods for turbinate reduction based on heat, while the third post delves into various aspects of these nasal operations. In this blog post, I've also provided some contact information for doctors who perform nasal implant surgeries to reduce the overly open space after having the turbinates removed or reduced in size. I also have several other YouTube videos that delve deeper into ENS and other related injuries resulting from nasal operations. Here are 2 examples of these informative videos. Feel free to visit my YouTube channel to explore more. If you want others to discover this video, you can boost its visibility by liking it, leaving a comment, or subscribing to the channel. Thanks for watching, and always remember, never trust the white coats.